to this virtual conference, Taking Stock of the Commonwealth. I'll say a little bit more about how we're going to run the thing in a minute. My name is Philip Murphy. I'm director of the Institute of Commonwealth Studies, part of the School of Advanced Study at the University of London. Just as a sort of a preliminary in terms of protocols, if you could turn your microphones off, keep your microphones muted, please. And also, I would ask, if you're not speaking, to turn your video screens off. It will help the chairs in terms of keeping touch with the panelists initially. And if you all are brought in for the question and answer session, then obviously please put your video on. To begin, it's my great pleasure to introduce the Vice-Chancellor of the University of London, Professor Wendy Thompson, to say a few words of welcome. Wendy joined the University of London as Vice-Chancellor in July of last year, following a distinguished career in government and higher education. She held the roles of the UK Prime Minister's Chief Advisor on Public Service Reform, as Director of Best Value Inspections at the Audit Commission, Chief Executive Officer at the London Borough of Newham, and MD of Norfolk County Council. She also held a tenured professorship at McGill University in Canada, where she was Director of the School of Social Work and Professor of Social Policy. Wendy, thank you very much for joining us and starting this conference.
Thank you so much, Philip, and thank you for allowing me to join you this morning. I'm very, very pleased to see the program. I think you'll have a great day from what I can see. So allow me to add my welcome to this online international conference, Taking Stock of the Commonwealth, which has been organized by the Institute of Commonwealth Studies, which, as you know, is part of the University of London School of Advanced Study. The 2020 Commonwealth Heads of Government meeting, Shogun, was due to take place in Rwanda this week, but the COVID-19 crisis has meant that the summit has had to be postponed. These meetings, which convene roughly every 2 years, are important in sparking a wider discussion, particularly in the media, about the Commonwealth and its role in the world. During lockdown, the Institute of Commonwealth Studies has been taking its own events online with a series of workshops and seminars that have linked scholars across the world. When therefore it was announced a couple of months ago that the Heads of Government meeting was going to be postponed, the Institute decided to stage its own entirely unofficial virtual Commonwealth conference this week in order to stimulate debate about some of the major issues confronting the Commonwealth. The response to the Institute's invitations to speak was overwhelming, and in a relatively short time, it has been possible to put together this remarkable program, linking speakers all the way from New Zealand to Canada and the Caribbean over the course of 12 hours. There will be 6 thematic panels over the course of the day. A number of these on media freedom in the Commonwealth, the Windrush generation, and LGBT rights are on subjects which relate to the Institute's ongoing program of research. The Institute has long been a national focus for work on Black British history, and it is currently engaged on a program of oral history research on the Windrush generation. During the last Commonwealth Heads of Government meeting, which took place in London in April 2018, press attention was dominated by revelations about the Windrush scandal. The recent Black Lives Matter protests across the world have brought the issue of the marginalization of BAME people back into the limelight. As such, it's appropriate that we revisit the Windrush scandal, and we're delighted to be joined by Reverend Ambassador Guy Hewitt, the former High Commissioner of Barbados to London, and the investigative journalist Amelia Gentleman, who together played leading roles in shaming the British government over its handling of the affair at the time of the 2018 summit. The Black Lives Matter protests have also revived interest in the legacies of colonialism and slavery in the modern world, and in the issues of reparations and restitution. This is another overarching research interest of the Institute, and it is the subject of one of our panels today, which will include a contribution from Professor Sir Hilary Beckles, the Vice-Chancellor of the University of the West Indies and author of a major study of the reparations question. It looks like a great program for the day, and I'm very happy now to pass over to Philip Murphy to chair the first session. Thank you.
Thank you so much, Wendy. So as Wendy mentioned, we have 6 panels over the course of today. And really, we wanted to keep the discussions fairly tightly focused on those issues. There are many different areas we could have touched upon, but sometimes the problem with the Commonwealth is it tries to discuss too much, bring in too many issues, and we lose focus. But in a sense, we couldn't start at this moment in time without considering the broader global impact of COVID-19 and what it will mean for all of us in the future, for our institutions, for international relations, for the very texture of daily life. And we've brought together a wonderful panel which covers different elements of that, that huge topic. And in common with the other panels, what we're going to do is really encourage a discussion between the panelists rather than set-piece presentations. You'll see that the Windrush panel will be slightly different later in the day. There will be more of a kind of a series of separate presentations first, but on the whole, that is going to be the format of the day. And so I'm going to start by asking the 4 panelists to introduce themselves a little bit and say really what their expertise is on this area, what sort of things they've been doing over the last few weeks and months related to this question of the impact of COVID-19. And then I'm going to start a discussion between them. And really just, rather than introduce them as such, just give my warmest thanks to all 4 for agreeing to take part. We're going to start with Suan Ong, who is a specialist in global health and health systems research from the Hock School of Public Health at the National University of Singapore. And Suan will be able to provide us with a kind of an overview of the medical health aspects, the immediate impacts and questions around that. We have Robert Patman from Otago's, the University of Otago. He is one of Otago's inaugural sesquicentennial distinguished chairs and a leading specialist in international relations, global security, and great power relations. From India, we're delighted to have Professor Pratap Bhanu Mehta, who is one of India's leading public intellectuals and the founder of one of India's most, indeed the world's most important think tanks, the Center for Policy Research. And finally, we have Sharon Remiss, who is Chief Operating Officer of the Association of Commonwealth Universities. Sharon's had a distinguished career in what you might call soft power diplomacy through the British Council, now the ACU. She is a linguist by training and has served in a variety of posts around the world, including in India, United States, and Brussels. So, Suan, just would you like to introduce yourself and say a little bit about yourself and your expertise?
Sure. Thank you so much for having me. It's a privilege for a young researcher like myself to be on a panel as distinguished and a little bit intimidating as this. So thank you very much for having me. I've just completed my PhD on health systems research at the National University of Singapore, where I did a comparative qualitative study and evidence review on the factors that come into prevention and management of type 2 diabetes. And it was a comparative study, incidentally, between Singapore and the UK. So I had a lot of fun with that. I will be joining the School of Public Health at the university as an adjunct research fellow shortly, and will be taking up a role as senior advisor at a social enterprise research consultancy very soon. So my interests are in global health, public health, health systems more broadly, but my first degree was in political science and international relations. And I sort of moved into health over time. So that's where my interests kind of intersect, and I'm really glad to be here today. So thank you.
Thank you. Robert.
Well, good morning, everyone. It's a great pleasure to join this gathering. I teach international relations at the University of Otago. And yes, Philip, when I first arrived in New Zealand, I called it Otago as well. But somebody said to me, no problem at all. Somebody said to me, just think of Wells Fargo, Otago. So my interest, as someone interested in international relations, I've been, like many people, deeply affected by what's been going on in the world. It's an unprecedented situation. And I've been writing a book for Palgrave Macmillan about rethinking the global impact of 9/11 and looking at some of the deeper patterns in international systems. So COVID-19 struck me as a very important trend because it's a trend which does not recognize borders. It's one of those challenges that states face. And it's not alone. It's, many of the issues facing states today are transboundary in nature. And so, yeah, I've been deeply interested in that. I teach international relations, US foreign policy, international security at the University of Otago. And I'm looking forward to our discussion on this issue, which is so multidisciplinary in its focus, really. And particularly interesting to myself, I direct the Master of International Studies, which is a multidisciplinary program at the University of Otago. And so, in a sense, my interests and this trend, I wrote a book in 2015 with a scientist called Science Diplomacy. And it's been interesting, some of the ideas that we discussed in that book, Science Diplomacy, New Day or False Dawn, which was published by World Scientific Publishing in Singapore. Some of the things we anticipated in that book, we've begun to see some of the debates around that develop now. So that's been quite interesting. So that's a little bit about my background.
Thank you very much. Pratap, please.
It's a great privilege to be here. Very briefly, I'm currently teach political science. That's my original discipline. I started out in political theory and have always been interested in the intersection of political theory and constitutional law, but then through a meandering career moved to the policy world and back to academia. And very simply put, I think many of us have been kind of engaged here in trying to think through what the COVID crisis means for us collectively. And in particular, what seems to be very distinctive about this crisis is the way in which it has accelerated, if not started, the very fundamental question of what the nature of our social contract is going to be, both domestically in each of our democracies, and of course, globally, internationally, in terms of the kind of multilateral institutions, world order that we can actually imagine going ahead. And so in some ways, we've been involved in discussions. I was involved in a prior elected project on sort of India's strategic and foreign policy in Alignment 2.0. We are in the process of kind of rethinking what that actually means at this historical juncture. But my own particular work has been to actually think of the ways in which the social contradictions that are emerging in India in the wake of the COVID crisis really have the potential of shaping and reshaping the nature of our social contract and the nature of the Indian state. So look forward to learning from our colleagues.
Thank you very much. And Sharon, please.
Thank you very much, and thank you very much for the invitation. It's a real pleasure and a privilege to be here at this, I think, really timely conference. As you said, I've worked quite a lot over many years in soft power in some ways, but always very much in that higher education space, and have worked with universities, obviously from the UK, US, across Europe, in India. So it's been very much part of my DNA in some ways. Now, though, today I'm really going to talk about it from the sort of perspective of the Association of Commonwealth Universities, which is, we've been engaging with our 500 plus members, which cover really across the Commonwealth, from obviously UK, Canada, New Zealand, right through to Vanuatu, to Singapore, everywhere. So it's right across the Commonwealth. It's a really rich insight. So what we have been doing is we've commissioned some research, we've been gathering evidence to see how COVID has impacted our member universities, and then what we can do really to work with them to prepare and build in that resilience for the future. And I think, as I say, 500 plus members, hugely diverse, 66% in low and middle income countries, 5% in small states. We're across 5 continents. It gives us access, if you like our network is 10 million students, 1 million faculty and academic and management staff. And the ACU really works with members, for our members, and we're governed by our members. So our council is made up of vice-chancellors of member universities. And what we do is really connect and coordinate, convene, and we use our accredited status at UNESCO and various other platforms to really be that sort of collective voice for the value and power of higher education for society. We strongly believe that global challenges can really only be solved through higher education. And that's why our strategy is very firmly anchored in the SDGs, where we think that higher education has to be involved in every single one. It contributes to the delivery of all of them. So I would say that my starting point, if you like, from the world after COVID-19, from an ACU perspective, is that universities will be part of the solution. And I think that's really the starting point. So I'll talk about some of what we've been doing and some of the messages and the data that we're getting back from our universities from across. And I think somebody said it's impacted everybody in different ways, and sometimes in surprising ways. And there are some good stories and some real concerns, but I think there are some also real opportunities, and that I think is what is emerging from across the Commonwealth. Thanks.
Thank you very much. Can I just say a couple of things before we get the discussion going? Firstly, if you'd like to ask a question, pose a question to the panelists, we'll have at least half an hour, possibly more, of questions at the end. Please use the chat function. You can see the little chat box at the bottom of your options in the middle. And you can use that to post questions, or even post links to materials you think might be of interest to the panelists and the audience. So please use that. And panelists, if you would like to come in and ask your fellow panelists a question at any point, please just sort of raise your hand, and I'll bring you in. Also, please do tweet about the conference. We have a hashtag ComConf, which is up there on the chat. So please use that to publicize what we're doing today. I'm going to start with Suan. And we're going to start with the immediate health consequences of COVID, and what the outlook is for that. I mean, Suan wrote a piece in Roundtable Journal towards the end of April about Singapore's response. It looked at the time as though Singapore was doing fairly well in its immediate response to COVID. But what are the public, how well has it done in the meantime? What's the story been since then? and what are the challenges for governments around the world in terms of health measures, things like quarantine. Where are we with finding a vaccine? Is a vaccine going to solve the problem? So, Suan, could you start by maybe talking about some of these challenges?
Yeah, sure, absolutely. So, little disclaimer, I've been in Singapore for a very long time, but I'm actually Malaysian. So my worlds kind of intersect with these two very closely linked Commonwealth countries in the region. So with regards to Singapore, this is actually quite funny because 2 or 3 days after I sent my commentary off to the round table, the outbreaks of COVID-19 within foreign migrant worker dormitories escalated very rapidly. So as many of you are aware, Singapore is a highly developed city-state that is very dependent on low-wage migrant labor, primarily from the South Asian subcontinent. Many of these workers are housed in very large dormitories that often house multiple men per room. They have shared bathrooms, shared kitchens, lots of shared facilities, which also means lots of opportunity for them to come in contact with each other. And this is just in the working areas. This is just where they live. And it's compounded by the fact that they work together in construction sites, at ports and so on. So what we've seen in Singapore has been described as a tale of two outbreaks, one outbreak in the local community and one within the dormitories. And the shapes of those curves are both completely different. And the ways that they've both been managed has also been completely different. So Singapore has entered what we are calling phase 2 of the post-circuit breaker period. So we are allowed to have up to 5 visitors per household. We're allowed to gather outside, maximum of 5 people in a small group. Children are starting to go back to school. People are starting to go back to work. There is a sense of euphoria in the air, and people are very excited about the changes. Also, the Prime Minister dissolved Parliament yesterday and has called an election for the 10th of July. All this has happened in rapid succession. So very interesting to observe. Our community case numbers are quite low because of very active surveillance and contact tracing, which I will talk about a little bit later. And the numbers in the dormitories are going down, but it has been a little bit of a PR crisis for Singapore in a way to see our numbers go up so dramatically because of one particular vulnerable segment of the population. There's a lot of uproar about how we missed them. How could we have missed them? It was right in front of us and it was a blind spot. The Singapore government, to its credit, mobilized healthcare teams very quickly to get out to the dorms to do swabbing and testing and isolating. So we are seeing things improve, but there's a lot of learning to be done with how we have cared for or not adequately cared for the low-wage migrant population that builds our trains and our skyscrapers and clean our streets and prune our trees. So there's a really important conversation that has emerged as a result of that because of COVID. And this is to do with what Ms. Memis was saying about unexpected things coming up. Things that we didn't expect to learn, but here we are. So that's, I think, what I'll say about Singapore. With regards to broader issues around COVID, there are many. I will try not to bore you. I will talk about a few. They are not in order of importance, but I'll just go through a few. So the first big thing that a lot of us really care about, not just in health, but also beyond in the policy and politics sphere, is surveillance testing and tracing, which is the process of identifying, assessing, and managing those who've been exposed to prevent onward transmission and try to break transmission chains in the community. So this requires identifying people who may have been exposed to COVID, following them up for about 14 days. So we understand now that the incubation period for the disease is about 10 to 14 days from exposure. The challenge with surveillance testing and tracing is that contact tracing is very, very labor intensive, and it requires two things: a very devoted team of humans to run the show and a very robust system to collect, compile, and analyze data in real time. So this is not just ministries, this is academic teams and so on, all working in collaboration. a big thing to remember here is that not all countries have the capacity to do it. And Singapore has been very, very proactive on this, but Singapore is also a very wealthy country with a lot of capacity, not just in government, but also in research. There are also issues around surveillance testing and tracing. So a quick example I'll give you is of Singapore. So we have this app called Trace Together, which runs on Bluetooth and operates on exchanges with other phones that have Bluetooth technology as well. It's supposed to let you know when you've possibly had close contact with a potentially infected person, and it's a way to do contact tracing in the community. However, uptake has been pretty low. The last I remember was 1/5 of the population had downloaded the app and kept using it. And there are issues around technology. So one of them is that the app really drains your battery, which is a real barrier to uptake, for one. And for two, there are concerns around data privacy, and something that even my friends have said is, so does this mean the government knows where I'm at any point in time and who I've been with? And there are real discomforts around that. So those things remain a work in progress, and we're still sort of taking our time through that. The second big issue is vulnerable populations. So we know from the research that has come out of many places since January that the mortality rate from COVID is higher among those who are older. And evidence shows that mortality does increase with age, which is not that surprising because evidence does show that risk of COVID mortality is related to pre-existing conditions like diabetes, heart disease, and asthma, all of which are naturally more prevalent in older people. And then the second point is kids. So kids seem to do pretty well overall when it comes to surviving COVID, but there's reporting of Kawasaki-like inflammatory syndrome among kids in certain countries, including the UK. And this is raising some red flags that people are starting to pay more attention to. Another vulnerable population I'll talk about is migrant populations. Again, as I alluded to earlier, Singapore is a very, very clear example of that. Another example is a non-Commonwealth country that was under the crown at one point, Myanmar. Many issues around the porosity of the border with Bangladesh and movement of people across borders there. Difficulties around testing migrant populations, because not all of them have documentation. The borders are not very well guarded. And both Myanmar and Bangladesh are not the most well-resourced when it comes to testing. So we may not be aware of the full load and exposure and transmission that's occurring over there. Another thing I'll say is that we are dealing with a lot of what to do now with regards to isolation, quarantine, and lockdown measures. So the terminology is used quite interchangeably in the public, but the distinctions are as such. So quarantine is when you restrict activities or separate people who are not ill but may have been exposed with the goal of preventing disease spread at the time when people develop symptoms. Isolation is separating people who are ill with symptoms and may be infectious to make sure they don't spread it to anybody else. And then there's physical or social distancing, which is a general measure that the WHO has advised everyone to take, even if they are well and have no known exposure to COVID. And the distance is kind of arbitrary. The WHO says 1 meter, some countries say 1.5, some say 2. It's pretty unclear scientifically exactly what the optimal number is, but that's ongoing research. As to policy-wise, a lot of countries are unclear when to lift lockdowns, how to lift lockdowns, how strict they should be about keeping the population staying in their homes, and how much they should be allowing people to mingle, to return to work. There are, of course, mental health and economic concerns here. What's happening is that everyone seems to be looking to other countries for some sort of guidance or some sort of example. And in this part of the world, we have looked a lot to South Korea and China for lessons and for real-time information. And I'm aware that Singapore in particular, has been looking at outbreaks in South Korea and Beijing very, very carefully, and using that to inform policy making around lockdown lifting here. From a public health perspective, we're also really interested in behavior, human behavior at multiple levels. So from an individual perspective, things like hand hygiene, not touching your face, which is a surprisingly difficult thing to do. Things like individual and community level mask wearing. There's been some challenges around this because at one point the advice was it doesn't help, and now the science has shown different, and now we do, which can be very confusing to the general public and frustrating because the messaging is seen as inconsistent. But what we are trying to do from the policy side is revise our advisory based on evidence as it comes in. And part of that involves admitting that, okay, maybe we were wrong in the earlier instance, and more data is coming in to let us know that we can change things around. Organizationally and workplaces wise, we're trying to figure out new hygiene protocols for restaurants, for workplaces, for public transport, how to manage infection control, how do we work in split teams, how do we separate work from home with all this Zooming that we are doing, and how much physical and social distancing is absolutely necessary to keep this disease at bay when in a situation where we don't know how long it's going to be around for. There's also, as I'm sure you are aware, a bit of an infodemic occurring with much fake news, misinformation, thanks to social media, word of mouth, and my most favorite thing, forwarded messages of unknown origin. Nobody knows where they came from, but somehow everyone's aunt has one and has sent it to you, bleach or no bleach. There's a lot of questions in the public health sphere around the role of social media companies and what responsibility they have to fact check and filter and let people know what is true and what is not. And another thing is we're saturated with COVID information and people are starting to tune out. So from the public health communication side, we're wondering, how do we prevent this? How do we delay it? And also, how do we keep people interested? Because as long as people are interested and pay attention, they're more likely to listen. But if you overload them with COVID-19 information and advisories, it's likely like they'll tune out, and then this will have implications for behavior and information seeking, which may have longer term implications for the pandemic. We're also working hard, and this is going to be a very painful thing to do, to study mental health and the impacts of lockdowns and quarantines. So we're interested in loneliness, boredom, isolation, depression, especially in vulnerable populations like the elderly, who are more likely to contract serious illness from COVID. In Singapore and Malaysia both, we've actually seen increased reports of domestic abuse, elderly abuse, child abuse during lockdowns. And there may even be underreporting because when you are locked down with a family member, you cannot escape them, and reporting may result in other problems. An area we want to study further is also mental health of healthcare workers, which has been very gravely affected by the new demands of this pandemic. Access to health services is also an issue. Firstly, for people with COVID who may be from more disadvantaged sectors of society, in places that may not have universal health coverage, and COVID bill shock can be a problem. And for those with other conditions those with chronic conditions, for example, who need regular care, what are the implications of them potentially delaying their treatments due to the risks posed by going to a hospital when COVID is rampant? And what are the implications if there's potential exposure to COVID patients in healthcare facilities? These are some things that we're thinking about. From a much higher up perspective, leadership and governance in health and healthcare has really come into play. We've seen New Zealand do extremely well and do a beautiful job with Prime Minister Ardern in her compassionate leadership style. New Zealand has managed to get their numbers very low and be very decisive about the way that they've managed COVID. It is difficult for me to comment on the success of other countries, so I shall refrain. But another example, I guess, of leadership is what Singapore has done. They established a multi-ministry task force at the beginning of the outbreak to show that multiple ministries were working together and recognizing that COVID was not just a health problem, which I thought was incredibly clever signaling to the public. And then another example is in Malaysia, when we had an altogether unexpected switch in government in early March, a lockdown on the 18th of March, and there was a lot of political infighting, shall we say, with challenges around who was in charge and who was accountable. We had a charismatic, trusted, and most importantly, rather apolitical health director general who stepped up, took charge of the government's COVID-19 response. He managed all the risk communication to the public, and he's kind of emerged as a big hero in Malaysia out of all this. So regardless of all the political challenges happening in the background, it was really important to see a qualified, calm, composed, transparent, decisive leader emerge out of all of this. Again, another unexpected thing.
Okay, thank you very much.
Yep.
I think I'm gonna ask the other panelists whether they would like to come in at this point and say something about the issues you've raised, or just their own national experiences. Again, keeping on the specific health point at the moment. Robert, from the New Zealand perspective, Suan has
I'd like to react to Suan's presentation, which I thought was excellent. On the New Zealand dimension, I think Jacinda Ardern is one of those politicians who, this is a non-partisan point, I hope, just looking at it from a detached point of view as much as I can do, I think she's one of these politicians that combines two important qualities in a leader, namely has the ability to empathise and show compassion. She did this very well after the Christchurch terror atrocity in March 2019, when New Zealand experienced its worst terrorist attack on New Zealand soil, which was carried out by a white supremacist, which killed 51 people. But it isn't just extending compassion and what I call the ability to feel other people's pain. What helps someone like Jacinda Ardern is the ability to take steps to address the causes of pain. And I think with respect to the COVID-19 crisis, what I thought was quite impressive about the New Zealand Prime Minister and her team was that she listened very carefully to healthcare professionals and experts, and also looked to the experience of the likes of Singapore, South Korea, Taiwan, other countries which had encountered the problem earlier and had performed impressively. So I think, it's that ability to combine compassion but act decisively, and also to carry the population with you in doing so. That is, articulate it in a way that makes sense to people. But I think also an ability to learn from the experience of other countries, and here's another big factor, take advice given by institutions like the WHO very seriously. And that advice was there from about mid-January onwards. And a number of, without naming names, a number of countries didn't take that advice particularly seriously. And I think that if you look at the countries that have done well during COVID-19, there's almost a fault line, really, between those that try to learn from the experience of others and listen to the World WHO and those who didn't. And I think the consequences have been profound.
Thank you very much. Pratap, would you like to come in and say something about the Indian response, the Indian experience of the health?
Okay, thanks so much. It's hard to follow that wonderful presentation.
It was great, yeah.
I think 3 or 4 points. So, I think India started off well, at least on one point, which was recognizing the seriousness of COVID. And unlike some other countries, I think there was no resistance to taking WHO advice. And it announced one of the most draconian lockdowns that any economy has faced. We can argue whether they could have done it a couple of weeks before or all of that, but at least that phase was quite decisive. After that, however, I think after the lockdown, I think India's response has been a matter of great concern, let's put it this way. I think we frittered away the lockdown. And we frittered away the lockdown, I think, in three significant respects. One, I think, in the way in which we announced the lockdown, without, in a sense, adequate preparation and taking on board, I think, the government machinery that would have been required to make the lockdown a success. We just neglected one very important segment of India's working population, namely migrant labor. And you're talking about 300, 400 million people, which is nobody in government seemed to ask a very simple question. If you deprive about 300 to 400 million people of their wages for the next month, month and a half, and these are people who cannot survive a week without drawing on wages, what do you think is likely to happen? Nobody asked the question, given the kinds of conditions under which most of this labor lives, what is the best you can do? I know it's a big challenge in Indian conditions, but what's the best you can do to make sure that the spread of the disease is minimized once we come out of the lockdown? And so there's a real danger now that I think India's ended up with a little bit of the worst of both worlds, which is we had the lockdown and took a very big economic hit. But the lockdown simply was not sufficient to prevent the spread of the disease. So when the Chinese locked down Wuhan, right, the idea was that you, in a sense, quarantine Wuhan and make sure kind of nobody gets out in some ways, so that, in a sense, the disease is contained. In India, what happened basically was after roughly about a 6-week lockdown, all that migrant labor, in a sense, started going back to different parts of India where they came from. And I think the jury's out still, frankly, on how widespread the impact of that is actually going to be. Right now, the areas of concern are still the bigger cities. Delhi's in bad shape. It's like New York was maybe 2 months ago. Mumbai, Chennai. But there is a big open question on how is rural India going to fare. We are keeping fingers crossed. It's not alarming yet. Partly we're just not testing it out, so we don't know. But I think the big test for India's policymakers is going to be the next 4 to 6 weeks as we, in a sense, have emerged out of the lockdown. So I think that's the first, I think, the sense in which we did not use the lockdown well. We did not strategize about how we would need to move people around once we came out of the lockdown. I think the second issue is really how do you prepare your health systems and health services? And how do you use the lockdown period to prepare? And this is where I think we have seen the widest variation across India. I think one of the big successes so far, I think in COVID, one has to be cautious because I think it'll take 5 or 6 months before the full data is in and we see how the disease pans out. But the state of Kerala, for example, did relatively well. And it did relatively well because it was able to deploy civil society, strong local institutions to do exactly the kinds of things that Suan was talking about, which is, contact tracing, follow-up, quarantining. And so Kerala has actually been one of the big success stories. And I think one big lesson coming out of the COVID crisis is that states in India that had relatively good public health systems, that had relatively good social capital, relatively good decentralized governments, have actually done much better than cities and states that did not. And that's why you're seeing a crisis in Maharashtra. That's why you're seeing a crisis in a city like Delhi. So I think you'll get a lot of regional variation, I think, in some senses coming out of this crisis. And Delhi is, as I said, right now facing serious public health crisis. I mean, there is an acute shortage of health workers. There is a shortage of tests. There is a shortage of PPE kits. And I think it's very clear we did not do as much as we could have during, I think, the lockdown period. I think the third big issue, and this is going to matter a lot as we move in the weeks ahead is that one of the challenges with any lockdown strategy is that the lockdown has to be sustainable. Now, what the threshold of sustainability is, of course, varies from society to society. And there are many democracies where, frankly, there seems to be a kind of cultural aversion to lockdowns. I think in India, that wasn't the case. But as I said, if most of your population cannot survive for 4 to 6 weeks without some form of income support, the lockdown is not going to be sustainable, right? And I think one of the big puzzles about the Indian government's response has been that it has actually been relatively conservative on the fiscal side. In fact, of almost all the advanced democracies that we have seen, the extent of fiscal support that it has promised workers has actually been the least impressive. Most of the support has been in the form of loans to businesses, but there's, for example, been no wage support. There's been almost no, one or two exceptions apart, almost no cash transfers, almost no income transfers. So other than providing some distribution of food, one of the big surprises, as I said, of this lockdown has been why the government of India has been fiscally much more on the conservative side. Now, a lot of that has to do with the weakness of the Indian economy as we went into the lockdown, which reduces your head space in terms of headroom, in terms of being able to provide a fiscal stimulus. But I think that lack of fiscal stimulus is probably going to sharpen social contradictions as we, in a sense, move into the next phase. The last and final thing I'll say at this point, I mean, there's lots to discuss going ahead, is that you almost get the sense, to be very honest, I think, that a sense of fatalism is now creeping in about our COVID-19 strategy. And what do I mean by fatalism? We banked on a lockdown to save us. The lockdown did not. It probably did slow the progression. It did buy us time, but we have not utilized the time as well as we could have. And almost all the states have opened up. And unlike in most places, our opening up has also been almost as dramatic. So there are restrictions on public assemblies, things like that. But by and large, most workspaces and so forth are still functioning. We are actually seeing a reduction in some states in testing, or the number of tests is actually stagnant, and very few attempts to trace and quarantine, which is something that we had actually seen in the early part, as it were, of our response. So, it's like perhaps in some states in the United States, there's a sense of fatalism creeping about this, keep our fingers crossed, hope it doesn't get too bad, and there for the grace of God go we. I think the other thing that I think muddied the waters a bit is that not only did India face a COVID crisis, it simultaneously faced an economic crisis, and frankly, now it's facing a geostrategic crisis. It's hard to overestimate the degree to which the crisis between India and China is simply going to take away attention, political attention, and social attention from thinking about the COVID crisis. So I think you have a government that is having to operate at the maximum bandwidth you expect of any government, dealing with a medical crisis, an economic crisis, a geopolitical and strategic crisis, all at once. And frankly, it's struggling. It's struggling in part because, talked about leadership a lot. Mr. Modi has incredible political capital, and frankly could have, I think, mobilized society in very constructive ways. But he has decided to do two things that I think have impeded the COVID response. One, he has persisted with a very centralized form of governance. So there's very little consultation before decisions are being taken, particularly consultation with other branches of government. And second, I think instead of bringing the country together in this moment of national crisis, he has decided to continue with some of his divisive political agenda. So the attack on civil liberties, the detention of journalists, the kinds of things that had been beginning to afflict the Indian state prior to the COVID crisis. Instead of putting a pause on them, the government has, in a sense, accelerated them. And I think that makes the prospect of collective social mobilization around an effective response to COVID that much harder. I'll stop there.
Thank you very much. Sharon, would you like to come in on any of these points on the public health side?
I think on the public health side, I mean, I thought, Suan, that was brilliant. It was really, really instructive. I mean, in a sense, sort of covering, I don't think I can comment on the whole of the Commonwealth and how that has happened on public health. But I think a couple of things that are emerging as well from the survey that we have done is, obviously, the impact is very different across the Commonwealth. And the important point you made, Suan, about the fact that Singapore is a wealthy nation, and therefore it has great connectivity, so it can do the tracking, the tracing. It's costly. You need great connectivity. You need all sorts of things, and I think that to state the obvious, one simply doesn't have that right across the Commonwealth. It's not a uniform picture. How different governments have then managed that, I think, is a separate issue, which I won't touch on. Although I do think that probably many countries are deeply jealous of the Prime Minister of New Zealand, who I think has done an extraordinary job there. So one of the things that's very interesting is that our survey has showed that, as I said, virtually all universities have been impacted, but 51% of our institutions have been fully closed. So 51% of the universities of those who responded to our survey have closed, with another 41% partially closed. So that's over 90% institutions really quite heavily impacted. Nonetheless, again, coming back to this point really, that solutions will often need to come from the universities. We've had some incredible stories of how students and universities are really contributing to society in incredibly innovative ways. So, we've got Kenyatta University, and they were certainly in the press as well, that they produced the country's sort of first homegrown prototype ventilator to help treat patients. Again, low cost. At Stellenbosch in South Africa, students were working in 3D printing, producing protective gear for people working on the front line. Lots of universities, a number from the West Indies, Namibia, Asia Pacific, have started to use their labs to produce hand sanitizer. So there's some great stories of how the universities are really helping that public awareness. And certainly other responses that we got back from in the research which we conducted with our members was that, yes, there were the issues of pedagogy and teaching, which I'll come on to later, but one of the big things was the whole public health and mental health issue, and the need for universities to rethink as they opened how to actually manage what most see as something which will be ongoing, that there isn't going to be necessarily an end, but it's going to be ongoing. But that lots of sort of work and innovation, which will be incredibly useful for the world sort of going forward and in public health. So I think that's probably, I'll stick to those comments. Thanks.
Thank you very much. Thank you very much indeed. I want to move on. We'll take two further stages of this. First, if you like, the texture of daily life and how we think about the world and how we react to one another as a result of COVID. And this is speculation, but this is a fruitful pastime. And then the how it may affect the international order and relations between states. And I would refer you to a wonderful article that Pratap has written in the Open magazine. And I've just put the link to that on chat. Really talking about how, in a very profound sense, COVID might affect the way that we react to one another, how we feel about ourselves, our lives, our relationship with nature. Pratap says the lessons we will draw from the crisis, the lesson is not that we need to is that we need to radically attune ourselves to nature instead of mastering it. I think that's right. So Pratap, would you like to talk a little bit about those broader issues and how COVID might affect the sort of texture of our daily lives?
So, it's one of those moments, right, where time is moving slowly, but history is moving very fast. Yeah. And this article was written in the first couple of weeks of the lockdown. I think we were a lot more reflective and hopeful, and I think a little less resentful of the world around us. But I think broadly three things. I think very, very quickly. I think one, of course, as I said, I think it's an interesting time where, at least in the discussions that we are having in our university and with young people around, I think for the first time, perhaps in the last 30 or 40 years, a great sense that some of the very fundamental assumptions of our social order at least need to be rethought. Quite what that means is a more complicated question. And particularly on three dimensions. One, as I mentioned in the article, I think in a sense the relationship to nature, which is that at one level, modernity has been, in a sense, propelled by this enterprise for the kind of mastery of nature in almost kind of all its most profound aspects. Not only have we, in a sense, colonized the planet in a sense, in every way possible, but the confidence about, right, that we can, in a sense, manage our world through just that mastery, rather than a little bit of humility in the face of it. I think climate change was one challenge that was already, in a sense, knocking at our door. But climate change was somehow had politically become too diffuse a matter. So everybody abstractly acknowledged that we needed to think about the planet as a whole. We needed to think about what we could do for our collective existence through the way in which we manage nature. And I think there was the sense that I think the COVID crisis would once again at least help us concentrate our minds on what some of those questions might be. Food chains, food supplies, our proximity in some senses, or rather our colonization of forest areas, all those things. But I have to say, I think looking at the evidence of the last 6 to 8 weeks, chances are we'll go in the opposite direction, which is that the intensifying geopolitical competition and just the sheer economic crisis that almost all our economies are going to face is going to become yet another excuse to not confront this very fundamental question about, I think, our relationship, to nature. And the second thing, and I'll just stop with this, there's a lot more to say, which is that, the COVID is one of those crises that, in a sense, requires unprecedented levels of social cooperation, right? It requires unprecedented levels of social cooperation at an interpersonal level, right? I can be asymptomatic, and yet I could pose a risk to you, right? So just my being, in a sense, could threaten you in some ways, right? But it also requires greater levels of social cooperation at the level of national economies. We are attuned to think in terms of competition rather than cooperation. And I think a large part of our structures, the way things that governed our economy and things that governed our public institutions, were so much attuned to the idea that all you needed to do was get the right incentives in place and mobilize, in a sense, the generative powers of competition to get optimal outcomes, right? Whereas the COVID crisis in every which way, right? I mean, in India, if one thing it should bring to our notice is the fact that you cannot make the poor invisible, right? You cannot make migrant labor invisible to how you think of social institutions. And so if it reorients us to think about what kinds of social institutions and social habits elicit voluntary cooperation more than cutthroat competition, it could reorient our lives in different ways. But I'm afraid we don't see much evidence of that happening at this moment either.
Thank you very much. Yes, and that's exactly what I was thinking actually when I was reading your piece recently. There's a huge difference between events pointing us in a particular direction and our political systems having the capacity to learn the right lessons and implement those lessons. And I think we've been seeing that in all sorts of ways in recent weeks. And indeed in international affairs as well. And again, I'll forward this link over chat to Robert's piece on the new geopolitics following COVID-19. And Robert, starts by making the point that really paradoxically, at a time when we need greater cooperation, he says COVID has confirmed the near breakdown of an international rules-based order. And yet, Robert, when you were writing that, you seem confident that we might be able to move on or move back to a period of greater multilateral understanding, cooperation. What is your feeling now about that?
I'm confident in the long term because the alternatives, politics is often, as Edmund Burke once put it, a choice between choices which are intolerable and those that are disagreeable. And I think there is no pain-free or no painless solutions in the challenges we face globally. I think on balance, for reasons which I'll try and explain, I think despite themselves, states out of self-interest alone will be forced to cooperate. I've got a couple of takeaway points that I'd like to emphasize, which you've sort of highlighted. First of all, I think COVID-19 is a disruptive event which will redefine the new normal in what has been and continues to be a prolonged international transition. We've been in a state of international flux or transition since the end of the Cold War. And COVID-19, I think, is reframing the geopolitical order for reasons I hope to elaborate on. I don't think there'll be any return to the pre-globalization era. And I do think, as I said before, states will be obliged out of self-interest to extend international cooperation. Another point, which I try and develop a little bit, and it comes back directly to your question, Philip, is that I think there is a new opportunity in an increasingly interconnected world for small and middle powers to play a greater role in the way the world functions. Much of our media is fixated on great powers, but one of the stories of the post-Cold War era is that unilateral action by great powers has been singularly unsuccessful. You only have to think of Russia in the Ukraine, China in the South China Seas, and the United States when it led, with a couple of coalition partners, its invasion of Iraq in 2003. None of these efforts to unilaterally project power have been particularly successful. Let me talk a little bit about the geopolitical context. I think most observers would agree that a post-COVID-19 world will be different, but beyond that, opinion is sharply divided. And I think there's at least two major schools of thought here that we should ponder. On the one hand, there are scholars and diplomats who believe the impact of the lockdown response to COVID-19 in many nations will reinvigorate nationalism at the expense of globalization. Globalization is seen as a project that's failed, and that nation states will strengthen their status as the world's important and legitimate players. On the other hand, there are observers that see globalization as a structural change powered by technological change, which has made the world much more interconnected, and that states will not be able to reverse this trend. And according to this view, there'll be no return to the globalization era. In other words, globalization is not just a project created by states, it's a structural change, and we can no more deglobalize than we can deindustrialize. On balance, when you consider these two competing views, on balance, I think, and this comes back to your question, Philip, on balance, I think the evidence suggests the second perspective is more likely to be valid. I think there's three reasons for this. Firstly, and coming back to my slightly optimistic approach, firstly, disruptive events such as COVID-19. If you look at other disruptive events such as industrialization, such as the end of the Cold War, these sort of really systemic affecting events lead to the emergence of new perspectives, new daily routines, new power relations, and resource distribution. I think the response of states to the COVID-19 pandemic, and this is the second point, has highlighted a clear fault line in global politics. And I don't want to reiterate what we discussed earlier. I think there is a clear fault line between those states which have experienced some of the highest death rates from COVID-19, such as the United States, the UK, and Brazil. What have these states had in common? Well, they've all got populist governments, and they largely were initially indifferent to WHO warnings on the 3rd of January that COVID-19 was a public health emergency of international concern. They also appeared to be impervious, in fact, in some cases actually ridiculed the concerns of public healthcare experts. They also tended to emphasize national exceptionalism to deal with the problem. And they were, by and large, the UK, the United States, and Brazil were very slow to react to the threat of this virus. In contrast, we've seen some success stories. And we've mentioned before countries such as Singapore, Taiwan, Germany, New Zealand, South Korea. What these latter group of states have in common is they acted early, reasonably early, on the advice of the WHO. They consulted with a wide range of scientific and healthcare expertise, and they were prepared to learn from each other. The third factor, which leads me to think the second of the two competing perspectives of what sort of world's going to emerge, which I believe will be a more cooperative one in the long term. The third factor, and I think this is a really important point that's often missed, many of the problems facing sovereign states, both big states and small states and middle-sized states, all states, many of the problems facing them do not recognize borders, whether it be in the economic sphere, the environmental sphere, the health sphere, or the security sphere. Most of these problems now cannot be solved by unilateral action. And another problem that has been touched on by Pratap in his very nice article was the COVID-19. This is another problem that doesn't recognize borders. It's unfolding more slowly than COVID-19, but climate change will have much greater consequences. And I think it could be argued that COVID-19 may well sensitize us in a way that hasn't been happening so far to the problem, the really serious problem of climate change. So let me just conclude by saying I think there is an opportunity to reinvigorate the international rules-based order And rules were created not for the strong, but for the weak. And actually, the majority of countries in the world are not great powers. You could count in your hand the number of great powers that exist, probably 3 or 4. But the rest are medium-sized states or small states. And I think one of the lessons that come out of COVID-19, and I think it's come as a bit of a surprise to the country I live in, which is New Zealand, is that the response to COVID-19 has caught the attention of the rest of the world. Those countries that have done well and those which haven't. And I think there is an opportunity, not just to defend the status quo, I'm not suggesting that, but to actually make a more cooperative, rules-based international system that is not dominated by the interests of a select few, but works for the many rather than the few. Thank you.
Thank you very much indeed. I'm going to ask the other panelists to come in briefly on Robert's points. I mean, maybe starting with Suan. I think that, you know, again, it's this paradox that we clearly COVID should force us to cooperate more. It's shown the need for international cooperation. But is that going to happen? Do we have signs that it's really going to happen, or are governments going to fail that challenge? I mean, in terms of international cooperation over health advice and information, the role of the World Health Organization, is COVID going to be represented by future historians as a success story for the World Health Organization or not?
So my crystal ball says ask again later. But I think a really interesting point to sort of latch the collaboration idea on is research in universities. I have been so inspired to see different research groups across the world immediately write to each other, call each other, and say, hey, let's do this together. We have worked with partners all over the world, established partners like Hong Kong and the UK, and new partners. A lot of new partnerships have been forged at this time as well. And I think that as we, as national governments start to realize more and more, not all national governments, but many, the importance of evidence-based policymaking, especially in health, especially in a moving pandemic situation, I think that organizations like Ms. Memis have an incredible opportunity to step in and say, we will facilitate these exchanges for you. We will get these things moving for you. We will set up meetings. We will help with grants, with funding research, with encouraging generation of important evidence that can be directly fed into both international governmental organizations as well as local and national governments. I think that's a really powerful thing that we could look at more closely as things progress. And all the wheels are already in motion for greater collaboration from an academic perspective. And I think that will be a really cool force to be reckoned with as we move forward. The extent to which people pay attention to it more broadly from a public perspective is a little bit blurry to me. But as someone who's been in the university system, I think the potential is just limitless. And when brilliant minds who care about health come together, like some pretty incredible things happen, pretty incredible collaborations happen, because the goal is the same. The goal is to learn as much as you can and get it out into the world. As to the WHO, because of the way that it's funded, what Professor Patman said about great powers and being part of this new global order, the WHO runs on donations from member states. And when, like it or not, you're going to be beholden, I suppose, is a very strong word, but you will be more likely to consider the concerns of your most important donor, recognizing that they play such a large role in your survival and your sustainability. I do not know that that model is going to continue working into the future. I do think, just purely personal, that the WHO is in dire need of reform and has been for a very, very long time. But that hasn't happened yet. And so far, nothing has pushed it far enough to have an existential revision of its mandate, of its funding mechanisms, of the role of member states, and so on. Maybe COVID that will be that thing, but I'm not completely sure. Yeah, and I actually have a question for Professor Patman. So you mentioned the role of small and middle powers as COVID progresses and what this may look like in a post-COVID world. So in a global order that is in a way led not by great powers, but led by groups of smaller middle powers whose economic survival really depends on the positive aspects of globalization, what do you think would be the disadvantages that the great powers would experience if they chose not to be a part of it? For example, the way the United States president said, we're pulling out of the WHO, we're pulling funding from the WHO. So what would be the active disadvantages of a large country that has quite a lot of military power, quite a lot of economic power on its own, as well as natural resources to keep it going and human resources to keep it going? What would incentivize them to come to the party, led by groups of states that are not them?
Well, first of all, thank you for your question. Excellent question, Suan. I'm not suggesting we're going to see anything like the erosion of the power hierarchy. You know, our superpowers in the 21st century, the United States and China, have more power than their counterparts from previous centuries. The question is the structure of international system is changing. So we're not talking about great powers getting weaker. It's just that their ability to use the environment to their advantage has diminished. They do not have the autonomy. They're more vulnerable and more interdependent than before. You ask, what's the advantage or what's the disadvantage of great powers? Well, they are interdependent. China, for example, depends critically on the US market for its exports. It depends critically on the EU. It depends critically on Japan. Japan and the EU are both closely wedded to the idea of a multilateral rules-based system, not least because they've done very well out of it. At the moment, we have an administration in the United States, the Trump administration, which is the first administration in the post-45 period, effectively to try to undo the multilateral rules-based system. A lot of Americans are very upset about it. The point to note here is that the disadvantages of spurning international cooperation when you cannot unilaterally fix things is considerable. And you only have to look at how countries have performed during the COVID-19 crisis to realize the advantages of those who've exchanged information and cooperated, whether it be amongst scientists or amongst leaders. For example, Jacinda Ardern has regular conversations with the leaders of Australia, Canada, many members of the EU, and not least your country, Singapore, and other leaders. So in a sense, I suppose the answer to your question is, if it's impossible to unilaterally determine outcomes for yourself, then there are considerable disadvantages from doing your own thing. Because the United States, for example, Mr. Trump has been saying that America's been a victim of international cooperation. But that's not how the rest of the world sees it. If you look at the top 50 corporations in the world, 38 are American. So they don't exactly seem to be a victim of international cooperation. So, yeah, I mean, I suppose my answer to your question is, I think self-interest would dictate that even the strongest powers have an incentive to cooperate. Most of the problems that we saw, for example, in an economic sense, that applies to China. In an American context, it applies both strategically, politically, and diplomatically. And yeah, I mean, if we look at these countries which have tried to do their own thing, let's be quite clear about this. Neither China nor the United States under the Trump administration has come out of the COVID-19 crisis particularly well. Neither of them showed leadership. Neither of them rallied the world. Where were our two superpowers when we needed them? This is a stark reality of the world we live in. And yeah. I'll stop there.
I'll bring in Sharon second, because I think that this will sort of feed nicely into the role of the universities. But perhaps first I could just ask Pratap if you'd like to comment on any of these kind of broader points about the international order.
So I mean, I think Professor Patman's presentation was quite persuasive. I mean, I think my big worry is that, and I guess this is our disciplinary bias, right? Which is that the forms of international cooperation that a country engages in must have the weight of domestic political consensus behind it, right? If they are to be sustainable. And I think we are in a very fraught moment where, I think as Professor Patman hinted, both China and the United States, not to mention Brazil and possibly India, are undergoing a deep internal legitimation crisis. In China, it'll be measured by the degree to which it requires authoritarian modes of governance. I think in the United States, notwithstanding what happens in November, I think the degree of political polarization is likely to deepen. And so I think the point that you made, Philip, which is that are we at a moment where the political systems of the major powers are internally going to find it difficult to actually create the conditions for the kind of global cooperation that is required? I mean, and look, it happens. I mean, if you give countries the choice, reform or perish, sometimes they do choose perish. So I think, given the dynamics of domestic politics in all of these countries, I think to me, that's the biggest driver, actually, that I think there are some deep inner structural contradictions in the United States, in China, in India, that are actually going to make the task of global cooperation harder.
Thank you very much indeed. I'm gonna come to Sharon now, and really to focus on the sector in which all of the members of the panel operate, the university sector. It strikes me there are two things. One was raised by Suan, which is that the universities might provide a model for the necessary international collaboration, that global community of scholars sharing information and knowledge. And that in that respect, the universities may be part of the solution to this. But they're also, in a sense, going to take quite a significant hit in all sorts of ways. The financial crises breaking out across the university sector, and many people, and some in government and some in the British government, might say that, well, that the university sector is ripe for reform. It's about time it was shaken up. One certainly sees signs of this from the British government at the moment. So what is the future for the university sector?
Thanks very much. What's the future for the university sector? That's a huge one. I will focus though on some of the ACU. I just wanted to pick up one point that really struck me about in Robert's article, when he talked about that sort of bottom-up strategic multilateralism, which I thought was a brilliant phrase and actually felt very applicable to that university collaboration and cooperation. And so I think he's absolutely right. The universities, I think, have really stepped up and are collaborating very generously, openly. They are part of the solution. And I've seen one of those sort of great maps where the lines of the sort of collaboration, cooperation on COVID matters is very dense. So it is really happening. Some of it is under the radar, some of it we know about. So I think the universities, because higher education has that ability to transcend borders, politics, we, I think, are able to, universities are able to really be the cheerleaders in many ways for that kind of cooperation across borders, which don't need, which can ignore politics in some ways. So I think the model, in a sense, is there, both at institutional, at faculty level, individual level, and indeed at student level. And I think that, you know, one of the things that I feel is really important, the British government obviously funds a number of scholarships, as do many governments. And I think we've been very fortunate, certainly because the ACU manages the UK government's main flagship scholarship programs, the Chevening, Marshall, and the Commonwealth Scholarship program, that actually the government has said, yes, we need to continue with these. And so I think that encouraging that next generation of mobility and interconnectivity is hugely important. But to look at some of the responses that we have got from our members across the Commonwealth, I think, you know, it's worth thinking that they're saying, yes, there are opportunities, but yes, there are also some real dangers. So some of the opportunities, I think, is that it's had an extraordinary impact, and looking at the teaching side, to really migrate very, very rapidly to online teaching and learning across the Commonwealth. And this is one of the aspects that I think all universities are saying, this isn't going to change. We will continue with this. When asked whether they thought this was the equivalent, an online degree was the equivalent of face-to-face, only half of them said that it was, and then there are all kinds of issues around security, engagement, and particularly vis-a-vis disadvantaged students. And I think that's another point which I'll come on to in a moment. However, more than 90% of them actually said that a blended degree is the equivalent to a face-to-face degree. So I think that that's maybe something that might not have been said some time back. And we've actually seen some evidence. We have as I say, we manage the Commonwealth Scholarship scheme, and certainly some quite innovative programs there where we have been working with university to do split site distance learning, moving between countries. And what we found there as well is that actually the quality of the distance learning, and particularly sort of the split site, has been as good as the face-to-face. So everybody seemed to be of the view that certainly online is here to stay, but that blended is the way forward. However, there are some worries in this sort of digital divide. Clearly, the people that responded to us had connectivity, so they were advocate, but they were very aware that there is 60% of them actually identified internet speed, data costs as a key problem. And it depends across countries, but this lack of access and affordability of internet is obviously exacerbating existing inequalities. The sort of wealthy urban young can study online. The disadvantaged rural populations are excluded. The cost is sometimes prohibitive, and some are talking about partnerships with governments, with the private sector, providing internet packages. But these are, they are possible solutions. And I think that what's emerging is this need for some really bold, brave, avoid a lost generation, because the wealthy, the advantaged, in a sense, will continue to survive. And that's not just exclusive to less developed countries. That's true. The inequalities are everywhere. And another one that many of them highlighted is that many are new. Many of the faculty members are new to online. It has to be much sharper.
Yeah, Sharon, your sound was breaking up a little bit.
Oh, sorry. Sorry. Is that any better? Yeah. Sorry. Let me see if I can get a little closer. So what staff are saying is that they actually need to do online teaching. It has to be sharper, better quality, and really thought through in a way that they can perhaps
Okay.
And so that sort of staff training, cost of connectivity is absolutely critical. So I think there are some real opportunities there. That things are going to change. More will be online. At the heart of it, though, those international solutions that you talked about, it really is the model. And I think that many universities are finding that international collaboration is able to happen online. There are issues around, obviously, lab work and sciences where real sort of face-to-face happens. But I think we're going to find a very different sort of program coming up.
The sound is breaking up a little.
Oh dear.
I'm just going to maybe bring in, because we're getting close to the end. I know Richard Reiser would like to come in and make a point about the position of disabled people, and I'm going to call him in a minute. If anyone would like to ask maybe a sort of final question to the panel, please use the chat function to do that. Pratap, did you want to come in? Were you sort of signaling that you wanted to come in on that? Okay, right, okay. In which case, Richard, can I ask you to come in and maybe sort of link what you say with the points that have been raised before? We're really thinking about what will happen as a result of COVID. So far as disabled people in the Commonwealth, maybe you'd like to say something.
Yeah, it's fine. I don't know if the controller can put my video on, then you might see me, but
I think you can do that actually, Richard. It's at the bottom.
It's still blocked.
Okay.
I'll talk anyway. I put on the chat where you can see our website, and just that we were started in 2008 following many of us meeting the Convention on the Rights of Persons with Disabilities, and it was James Mwanga in Uganda initiated. It was a member of Parliament there, and we were quite effective up until 2013, but for various reasons, funding, internecine arguments and so on, the thing collapsed. So after the global summit that the British government held in 2018, we had a little side meeting there, came together and met in New York last year, and have grown from the 29 countries we managed to get there to 43 now, which isn't bad for a sort of NGO type organization across the Commonwealth. And we're hoping to get up to the 50 plus in this year. And what's brought people together has been that we have been giving out consistent advice. Our executive committee, which meets regularly online and in person before the outbreak, has managed to develop policy guidance on what we should be doing. And a number of our organizations went in and talked to their government, some with success. Malaysia was one, Guyana was another, where they were actually on the decision-making level with government, recognizing that the 15 to 20% of Commonwealth citizens who are disabled are a significant number of people. And we are using the UN definitions, which are, of course, mental health, behavior issues, as well as physical and sensory impairments. And this is a very large number of people who are not usually taken account of, except for individual charities that do specialist pleading. We're not doing that. We do this from a human rights point of view. And therefore, what you've been discussing is very much the sorts of things that we discuss on our summits. We think that there needs to be a push, and I hope people out of this will use the channels they've got to push both the Commonwealth and the G20 to convene urgent meetings about how we go forward in the post or COVID situation. And for that, we have seen, for instance, from our members in India have shown that while the government said it was going to do things for disabled people, none of the food distribution or health support that was needed got to people on the ground. So, you know, which chimes with what was being said about India, too centralized, not collaborating. We're for collaboration at every level. We're for collaboration globally. And yesterday, UNESCO launched its guidance on inclusion as a way out of COVID, that we have to rebuild our education systems, where 1.6 billion children were out of school during the lockdown, on an inclusive basis. So using this pause to say, well, the SDGs, the Sustainable Development Goals, say we have to do this, let's go forward and do it. And in doing that, we need to restructure to include everybody. And I would say that's what we would be saying to all governments and independent organizations, universities. Don't forget the wide diversity that there is within the Commonwealth. We're the largest minority group, but there are many others, LGBT and so on. But we're a group that is often not seen as having a common interest, whereas in fact we do find that, for instance, the lockdown arrangements had major impact on, for instance, visually impaired people, people with autism and so on, not being able to even move around in their locality because they weren't allowed a guide, or because of their behavioural issues, they couldn't stay in the house. And it took quite a long time to get governments to actually bend the rules so that that could actually take place. So the last thing I'd say is that I think collaboration has to be the way forward. But obviously, you know, living in a country where populism is very strong with Boris Johnson and how he managed to get elected, it's been clear, and I think this is probably something we've picked up in other countries as well, that when you look at what's going on the ground, there is a tendency for people to want to collaborate much more than to not. But there have been real problems about old ideas about disabled people coming in. So, for instance, the rationing of medical resources to vulnerable people brought in old eugenics ideas very, very strongly again. When we talk about the old people, that's because more old people are disabled. And at 80% of old people are disabled. So it's not about age, it's about impairment that creates the vulnerability. And therefore, to dismiss people as vulnerable, when in fact we should be looking at the things that would stop them being vulnerable, is actually the key that we should have gone down, and we didn't. We were prepared to sacrifice a lot of people in institutions and care homes because we knew that there was going to be greater contagion there, but we wrote them off. And this is a eugenicist approach to a public thing. And what it comes from is the breakdown of the rules-based order coming out of the Second World War, where everybody's life was meant to be equal. I don't think we can say that everybody's life has been equal out of this COVID pandemic.
Thank you very much, Richard. I think I'm going to have to ask you to wind up there, because we're running out of time, and I'm going to ask the panel to maybe make some final thoughts. But drawing on Richard's point about international collaboration in terms of the promotion of the rights of disabled people, there's also a question on chat from Ed Owens, which is about, again, it's this gap between rhetoric and reality, that we've talked about the need for a greener, more sustainable future. But again, do we have the mechanisms for the necessary international cooperation to make that work? Is that greater multinationalism really going to come out of this crisis? So just final thoughts on that and any other issues you'd like to raise. So I'll start with start with Pratap.
Look, I mean, I think Professor Patman said it very well. If you're thinking in ethical terms and in rational terms, both of those terms, there is no choice but to go for multilateral cooperation. When you can't think of any of the major challenges that face all of us that can be solved in the absence of that multilateral cooperation. I think what we will need to, however, break down this abstract discussion. I mean, I think often public opinion is moved more by examples, more by things that convince people that the costs of multilateral cooperation are not going to be as high as their leaders are domestically making it out to be. So I think what we'll have to think through is what is the political case that can be made for that kind of cooperation, because that, I think, is to me is the missing puzzle. I think on self-interested grounds, on ethical grounds, the case is open and shut.
Thank you very much indeed. Suan, would you like to say something just in closing?
Yeah, sure. So regarding the sustainability point that Mr. Owens put forward in his comment, I think that even within public health, the terminology of sustainability, climate change, greening, there are no clear definitions, working definitions for what all these mean, and different parts of public health talk about it differently. So there's health system sustainability, there's environmental sustainability, there's healthcare sustainability, and use the same word, nobody can really agree on a classified terminology. And this is natural, but if we want to move this agenda forward, we're going to have to agree on some common definitions. Otherwise, it becomes a case of competing agendas, diluted terminologies, diluted understandings of what the problem is and what kind of goals we want to achieve. And I would say that on a broader scale, if we want to look at health sustainability and, multilateralism altogether moving forward, we're going to have to hash these issues out before moving forward, because as they say with data analyses and health, garbage in, garbage out.
Thank you very much. Sharon, would you like to say something?
I think on multilateral cooperation, hope you can hear me. I mean, clearly, universities have a huge role to play there. And I think the way that we at the ACU are trying to support our universities in the Commonwealth is really to use our accredited status, use our collective voice. So we, for example, are members of the Sustainable Development Solutions Network. We sit on the we'll go to the UN high-level political forum, where we'll be with our partners, who the IAU, AUF, who represent other international universities and the Francophone universities, and really get that sort of collective voice about and actually demonstrate, I think, the power of international cooperation. We're also working in areas, we have networks around peace and reconciliation, and an event hosted by Stellenbosch last week, where we were looking at how this COVID-19 crisis can be used to really reset the curriculum, and very much in the context of the Black Lives Matter, the decolonizing of the curriculum. We have a network around climate and resilience, again addressing some of those major issues, which was actually launched really by small island states who were most impacted. We have one around the SDGs. So we have all of these platforms that we're trying to create, which were before physically mobile, but now increasingly happening online, and are proving to be just as powerful. And I think one of the big messages as well in a project that we're doing as well with Fit in East Africa, where there's a huge shortage of faculty and teaching staff, is we were building that capacity with them for regional online teaching and training. So not the kind of Future Learn or the Coursera's, but actually developed within the region. And that proved to be also quite sort of transformative in the COVID-19 pandemic and crisis, and that they were able to use that and sort of mentor and guide other universities around. So I think the evidence for international multilateral cooperation is so strong that this, the universities are absolutely at the vanguard of that, but I think we'll see that happening much more as we go through. And certainly our role is to help make that happen and use our voice to make the case for higher education with governments and with multilateral organizations.
Final word to you, Robert.
Oh, thank you, Philip. Firstly, thank you for this excellent discussion, but just a couple of final points. I think firstly, with regard to the future and the prospect of multilateral cooperation, I think those who are against it, those who argue that the be-all and end-all is the nation state, that the international institutions are superfluous and cooperation is a bad thing, I think they are losing the battle for public opinion. And something that is often, that Sharon just mentioned about Black Lives Matter, what we are witnessing with globalization, many of us have thought of this term in economic terms, but it's also got political consequences. We're seeing the rise of international civil society, so that when George Floyd, an African American, was tragically and brutally killed, it didn't just affect people in the United States, but it affected communities all around the world. And not just, those communities weren't just protesting about what happened in America. They were, in places like New Zealand, they were protesting about the fact that race relations in their respective countries was not perfect as well. So it's interesting now how we have people with like-minded thoughts on issues can collaborate in a way which was possibly not possible even 2 decades ago. The second thing I would say is how does, and I'd like to come back to Richard's question, his excellent observations on disability. How do we, if you like, grow institutionally the prospects for multilateral cooperation? I think one key issue is that the UN Security Council must be reformed in the course of the 21st century. It's quite ludicrous when you have 5 members of the Security Council who have a veto. In other words, they have the ability to block everything that they don't like if it happens within the UN, which means that some of the most desperate places in the world do not get the attention they deserve. So I think there's a head of steam building up, whereby the permanent 5 will be asked to account for a privilege that no other member of the UN has when we live in an interconnected, mutually vulnerable world. I think the second thing is, and this is a big issue, and there's no easy answers to it, I think there needs to be an international debate on how we can get the global economic order or economic system to work better for more people. One of the things that I've been struck by some of the excellent contributions we've heard today is this problem of inequality. And it's not going to go away. It's probably going to get worse. We live in a world, according to the Oxfam last year, 26 billionaires had more wealth than nearly half the world's population, which is an incredible figure. It's not just a question of the lack of morality of that, but it's also a question of whether that's sustainable going into the future. Because, obviously people who are impoverished increasingly know that they are in relation to other people. So I think, one of the things I would dwell on is not only do we need more interdependence internationally, but we also need to mark that independence internally. Suan commented in her presentation earlier that we have become conscious of how all of us depend on people who may not be particularly well paid in society, but they make our lives happen, whether they be bus drivers, nurses, etc. And I think that's something else that may come out of this crisis, that we recognize somewhat belatedly just how much we depend on each other.
Thank you very much indeed. And I mean, Robert talked about the rise of international civil society. I mean, I'd like to think that this conference is maybe a little example of that that we don't have to wait for the Commonwealth Secretariat or Commonwealth governments to organise a Commonwealth conference. We can do it ourselves perfectly well. But this was an experiment. It is an experiment today. And I think when you're launching a new innovation, the key thing is to start with a really excellent panel. And we've undoubtedly had this today. It's been a fantastic discussion. A wonderful survey from Suan launching us with an overview of the health issues, and then a really fascinating discussion arising out of that. So thank you to all our panelists, Suan, Pratap, Sharon, Robert. We can't do sort of applause on Zoom, but I'm sure that people will record their appreciation of there's little hand signs coming up all over the place. Time to grab a coffee. The next panel begins at 10 o'clock, chaired by my colleague Sue Onslow, and it's on media freedom in the Commonwealth. So thank you all very much for taking part in this initial panel, and see you in about 10 minutes. Thank you very much.
Thank you.